An epidemic of a new clade of mpox began in Central Africa at least as early as September 2023. As of August 2024, more than 17,000 cases have been reported, with 517 fatalities, the vast majority in the Democratic Republic of the Congo. On August 14, 2024, the World Health Organization declared the epidemic a public health emergency of international concern. In May 2022, the World Health Organization declared a prior mpox outbreak, involving a different clade of virus, as a global health emergency. The disease had infected 87,000 individuals and caused 140 deaths when the WHO ended its global emergency in May of the following year. Mpox cases from clade infections were growing in the Democratic Republic of the Congo by September 2023, with several of them being identified in Kamijega, a mining town in the province of South Kivu. A nationwide outbreak was reported in January 2024. In August 2024, the Africa Centers for Disease Control and Prevention declared that spreading mpox outbreaks in Africa had become a public health emergency, with over 517 deaths being reported. As a result, the organization requested the help and intervention of the international community to control the spread of the virus and treat infected patients. The ACDC stated that the fatality rate of the strain of virus causing the outbreak was 3 to 4%. Significantly higher than the less than 1% fatality rate recorded during the 2022 to 2023 mpox outbreak. On 14 August, the World Health Organization declared the epidemic a public health emergency of international concern, or global health emergency. In 2024, 15 countries were reported to have identified cases of mpox. Over 96% of all reported cases and fatalities from the disease were confirmed in the DRC, with 16,839 reported cases and 501 reported deaths. The ACDC reported that 70% of reported cases in the DRC were in children under 15, as that demographic represented 85% of reported deaths. Epidemiologist Jacques Alonda expressed concern over the disease's spread in refugee camps in the DRC and its neighbor countries, especially due to the amount of pressure already applied on the national healthcare system by concurrent outbreaks of cholera and measles, as well as widespread malnutrition. As of August 16, 2024, a cumulative total of 16,839 suspected cases of mpox and 501 deaths have been reported in the Democratic Republic of the Congo. As of August 2024, 15 countries have reported cases of mpox. The WHO reported that new cases of the mpox strain, all of which linked to the outbreak in the DRC, had been identified for the first time in 4 East African nations: Burundi, Kenya, Rwanda, and Uganda. Ivory Coast also reported new cases for the first time. On July 30, 2024, the Minister of Health of the Central African Republic, Pierre Soms, declared an outbreak of mpox in Bangui, following a period of time when the disease was mostly restricted to rural areas. Soms said that some families in the country were hiding infected relatives in fear of being stigmatized, thus increasing the risk of transmission of the disease. On August 15, 2024, Sweden's Public Health Agency reported the first case outside of Africa, which involved a person who had contracted clade mpox during a stay in an area of Africa affected by an outbreak of the disease. In a public statement, the agency said that, while the case in itself didn't represent a higher risk to the general population, occasional imported cases may continue to occur. On August 15, 2024, Pakistan's National Command and Operations Center reported a suspected case of mpox in the province of Khyber Pakhtunkhwa, involving a resident of Mardan who had recently returned from an Arab Gulf state. The person was later confirmed to have been diagnosed with mpox by the Pakistani Ministry of Health, although sequencing of viral samples was still ongoing in order to determine the nature of the variant. Mpox is caused by the monkeypox virus. The virus is transmitted through close contact with infected animals or people, including face-to-face talk and other kinds of physical contact, contaminated bed sheets, clothing or needles, consumption of contaminated meat and sexual contact. In April 2024, researchers identified a novel subgroup of clade of mpox in Kamijega, a mining town in South Kivu, Democratic Republic of the Congo. Epidemiologists reported that the new variant, later named clade or clade 1b, had the potential to spread with greater ease compared to other mpox strains. The researchers theorized that the strain had undergone genetic mutations allowing it to spread more easily through human transmission, due to the mining town's remote location preventing most occasions of contact with animals that naturally carry and spread the disease. Dr. Placido Mbala Kingabeni of Congo's National Institute of Biomedical Research said that the results of the analysis marked a new phase of mpox from the prior outbreak in 2022 and 2023. since the new strain reportedly produced milder lesions, predominantly on the genitals, making the disease more difficult to diagnose compared to strains that cause chest, feet, and hand lesions. Umbala Kingabeni also noted that there might be a higher risk of silent transmission of the disease due to its different manifestations. The research team determined the detected form to be a clade I-type strain, which historically caused more severe symptoms in comparison to the clade II type that was predominant during the 2022 to 2023 mpox outbreak. Until June 2024, mpox vaccines were not approved by any African government and the efficacy of vaccines had not been attested by the Strategic Advisory Group of experts. Also in June 2024, Reuters reported that authorities in the DRC had approved the vaccines Jynneos, manufactured by Bavarian Nordic, and LC16, manufactured by KM Biologics, for emergency use. Jynneos was later approved in Nigeria, also for emergency use. However, Nishtar said that Gavi and UNICEF still had to wait for official requests from the countries affected by the outbreak, as well as definitive approval of mpox vaccines from the World Health Organization, in order to start ordering the doses and distributing them to affected nations. In response, the WHO announced the launch of a process that would enable access to vaccines for emergency use in countries whose national approval was still pending. On 14 August, the U.S. Department of Health and Human Services announced that the national government would donate 50,000 doses of the Jynneos vaccine to the DRC. The HHS also said that the U.S. had previously provided $17 million to support clade mpox preparedness and response efforts in Central and Eastern Africa. In the same statement, Bavarian Nordic also said that a study of the vaccine in children aged 2 to 12 years would take place in the DRC and Uganda later in 2024. On 16 August, China's General Administration of Customs said in a statement that national authorities would deploy screening measures for people and goods entering the country from areas affected by the outbreak for the following 6 months.